Hey guys, welcome back to Neuronify. This is another video of our FMTUT series and the chapter name is Violent Asphyxial Deaths. So under this chapter, we are going to study questions on hanging, strangulation, suffocation and drowning. So without wasting a single second, let's begin the session. So starting with our very first question, what is sexual asphyxia? Autoerotic hanging or strangulation is called as sexual asphyxia. Some sexual perverts, usually male, usually mentally deranged, consider mild asphyxia as sexual stimulant as there are more hallucinations of an erotic nature in some. Along with induction of asphyxia, he also practices transvestism and masochism. It is usually done by young male, usually in his own house, in bedroom or bathroom, and the door is locked from inside. It may be done in pairs or by homosexuals. Number 2, transvestism. Trans is across vest is clothes. Such a person who wears female undergarments, usually of fancy nature, and may even be wearing female wig and makeup. For asphyxia, he ties a ligature round his neck and the other end of ligature is tied to water pipe in toilet, foot end of the bed or to his great toe so that pulling the ligature causes constriction of neck and so asphyxia. Usually he can control the extent of compression. A pad is commonly kept between neck and ligature. Alternatively, he may tie a plastic bag on his head to induce asphyxia. And fourth, as masochistic activity, that is masochism or masochism is sexual gratification by suffering pain. He may cause injuries or burns on his body. Death occurs due to overcompression of neck, however, there is no question of suspension of the body. Death is accidental, though sometimes it is wrongly diagnosed as suicidal or homicidal hanging or strangulation. Moving ahead with next question, what are violent asphyxial deaths? Define it, classify them. Complete typical hanging, then PM findings on face and neck hanging, define types, PM features of each type. So what is the definition of asphyxia? Asphyxia is defined as, in one word, it is pulselessness. But it is defined as the mode of death in which the death is due to the failure of function of lungs. Hypoxia is a condition in which the supply of oxygen to the blood and tissues has been reduced appreciably below the normal working level due to interference with respiration. Now this is a definition, but in one word, it is called as pulselessness. What is the classification of violent asphyxial deaths? It is classified into 4 parts: hanging, strangulation, suffocation and drowning. Let's study hanging. Hanging is constructing force on neck is endogenous, that is weight of body. And 2 types, complete hanging and partial hanging. Strangulation is constructing force on neck is exogenous. Ligature strangulation, throttling, bandsdola, garroting, mugging, strangulation with knee or foot. In suffocation, smothering, gagging, choking, crush asphyxia, bandsdola, burping, irrespirable gases, and burning alive. And drowning, submersion, immersion, typical drowning and atypical drowning. Typical drowning means wet drowning, freshwater drowning, and saltwater drowning. And atypical drowning is dry drowning, hydrocution, or immersion syndrome, submersion of unconscious, and secondary drowning syndrome or near drowning. So what is the definition? Starting with hanging, what is the definition of hanging? Hanging is defined as the mode of violent asphyxial death in which air of entry to the lungs is prevented by construction of the neck because of suspension of the body by a ligature tied round the neck, so that the weight of the body is the constructing force on the neck. That is, the constructing force or constricting force is endogenous. So very important point or very important differentiating point between hanging and strangulation is the force is endogenous in hanging while the force is exogenous in strangulation. It is not essential that the complete body weight should constrict the neck. Death is possible even if a part of body weight constricts neck, because 3 to 5 kg weight is sufficient to constrict and occlude the arteries. So this is all about hanging. Now what are the types? Complete and incomplete. Complete, hanging from high point of suspension. There is complete suspension of body and therefore feet are above the ground and therefore complete body weight constricts the neck. And what about incomplete? Hanging from low point of suspension. There is only partial suspension, and since feet or some other body part is touching the ground, only a part of the body weight, sometimes the weight of the head only, that is 5 to 6 kgs, constricts neck. In this condition, feet may be just touching the ground, feet may be resting on the ground, knees may be touching the ground, body may be reclining position. So this was about the incomplete or partial hanging. PM findings are different in routine versus judicial hanging. As in the later, there is sudden fall of 10 to 15 feet. So in judicial hanging, we know that there is sudden fall, but in routine hanging, the findings are different than judicial hanging. So, what are the findings in routine hanging? Number 1. Under the ligature mark, there is a dry, white, and glistening pad of fat, which is also called a shining pad of fat. In about 5 to 10%, there may be laceration of muscles of the neck, especially platysma and sternomastoid. Laceration of blood vessel wall is rare. Usually hemorrhage in cervical lymph nodes. Rarely the lymph nodes are lacerated. Congestion and hemorrhage in trachea, larynx and epiglottis. Congestion and hemorrhage in esophagus and salivary glands. There may be fracture of tracheal rings in 5 to 10%. There may be fracture of thyroid cartilage seen in about 40% and fracture of costal cartilage in about 10%. Fractured hyoid bone is usually not seen, may be present in about 10% individuals, especially beyond 40, and whatever present, it is due to the fractured hyoid is usually not seen, but whenever it is present, it is due to the antero-posterior compression, labeled as antero-posterior compression fracture. Antero-posterior means the force applies from front to the back, anterior to the posterior. That is why it is antero-posterior compression. Fracture may be of greater horn or at the junction with the body. So fracture may be either you will find fracture of greater horn or junction with the body. Posterior parts of hyoid are displaced outwards, and periosteum is torn on the inner side of the bone. Obviously, if you are going to apply pressure from anterior to posterior, then the outer parts, or say posterior parts of hyoid are going to be displaced outwards. Usually no fracture of cervical vertebrae may be seen in about 10%. So these are the findings in routine hanging. What are the findings? Under the ligature mark, you will find a shining pad of fat. Then laceration of blood vessels is rare, and hemorrhage in cervical lymph nodes, congestion and hemorrhage in trachea, larynx, then congestion of hemorrhage in esophagus and salivary glands, fracture of tracheal rings, then thyroid cartilage, and even hyoid bone. So when you apply pressure from anterior to posterior direction, there is displacement of the posterior and there is displacement of the posterior parts of hyoid. Now, what are the findings in judicial hanging? The additional findings due to jerk during fall are: there is fracture, everything is found, but there is fracture of cervical vertebrae also, usually at C2 and C3 level, and sometimes at C3, C4 or C1, C2. There is laceration of intima of carotid vessels, there is injury to spinal cord, and there is injury to pons and medulla. So these are the features or findings in judicial hanging. What is general external PM findings? We learnt about the local internal PM appearance, routine hanging and judicial hanging. Now what about external PM findings? Neck is elongated, head is tilted to the side opposite to the side of knot, face is usually pale, sometimes cyanosed. There is cyanosis at lips, tongue, nose, ears and nails. Eyes are mildly bulging out, partially open. Pupils dilated, conjunctiva congested, sometimes petechial hemorrhage is present. In case of pressure of ligature on cervical sympathetic, that is facial nerve, the eye on that side is found open, and that is called as la fascia sympathica. It confirms antemortem hanging. So what happens in case of pressure of the ligature on cervical sympathetic nerve, which is facial nerve? So when in whichever side or in whichever direction the pressure is applied, the eye on that side is found open, and that is called as la fascia sympathica. It confirms the antemortem hanging. Tongue is usually inside mouth, rarely protruded out, and when protruded, it is brown in color. There is dribbling of saliva from the angle of the mouth. Angle opposite to the side of knot, its presence confirms antemortem hanging. So, as it is due to irritation of submandibular and parotid salivary glands by ligature. The dribbling occurs vertically downwards from the angle of mouth. So, what they are trying to say? So there is dribbling of saliva from the angle of mouth and the angle opposite to the side of knot. Its presence confirms the antemortem hanging, as it is due to the irritation of submandibular and parotid salivary glands by ligature. So ligature causes the irritation of the salivary glands, and there is dribbling of saliva. The dribbling occurs vertically downwards from the angle of mouth in a tilted head, and therefore stains may be found on the cheek during PM, seen as horizontal line on cheek. On or on t-shirt or say shirt, chest or place of hanging. Sometimes there may be little bloody froth at nose and mouth. Hands are clenched. Penis is erect, semi-erect with evidence of seminal emission. Due to relaxation of sphincters, there is incontinence of urine and feces. PM lividity is present all around the distal half of the upper and lower limbs. A line of PM lividity is also present on upper margin of the ligature mark. There may be petechial hemorrhages on face and distal half of the lower limbs. Due to prolonged suspension, the ligature, example nylon rope, may be stretched and therefore body may be found touching or squatting on the on the ground. Due to prolonged suspension, the ligature nylon rope may get stretched and therefore body may be found touching or squatting on ground. Now, what are general internal PM findings? We learnt about the external findings. Now, what are internal findings? Lungs. Lungs are congested, exude bloody froth on squeezing the cut section. Rarely there may be emphysematous bullae present. They appear due to rupture of intra-alveolar septum. Respiratory passages contain bloody froth, pleura, pericardium, meninges, brain and abdominal viscera may show petechial hemorrhages. Right chambers of heart, pulmonary artery and vena cava are full of blood, left chambers being empty. Blood is of normal color, the abdominal viscera are congested and the brain is usually pale, sometimes congested. So these are the points regarding general internal PM findings. We learned about the external findings, we learned about the local internal findings. In local internal findings, you have to write about the findings in routine hanging and your judicial hanging. And what about the definition? We all know the definition. Moving to the next question, strangulation, defined types. What is throttling? PM findings. Ligature strangulation, PM findings. So definition is, strangulation is defined as the mode of violent asphyxial death in which entry of air to the lungs is prevented by compression of the neck, by ligature or some other method, but without the suspension of the body, so that the force constricting the neck is the external force applied, that is exogenous force. So they're just trying to explain what we learned it earlier, that in strangulation external force or say exogenous forces required, and there is no complete suspension of the body, and externally someone has to compress the neck. So what are the types? Depending upon the method used to constrict the neck, strangulation is of following types. 6 types. Ligature strangulation, throttling, which is manual strangulation, Bansdola, garroting, mugging, strangulation by knee or foot. Very first, ligature strangulation. Neck is compressed by a ligature of which usually multiple rounds are given and no knot is tied. In ligature strangulation, there is no knot. Force is applied on the ends of the ligature to cause compression of neck, therefore asphyxia and finally death. Talking about throttling, it is also known as manual strangulation, that is, there is compression of neck by one or both the hands. What is palmar strangulation? When the neck is compressed by two palms held at almost right angle to each other, it is known as palmar strangulation. So, throttling is manual strangulation, that is, there is compression of neck by one or both the hands. And palmar strangulation, when the neck is compressed by two palms held at almost right angle to each other, known as palmar strangulation. What is Bansdola? Compression of neck with a bamboo or wooden stick. One or two sticks may be used. Compression with one stick is done when the victim is standing in front of hard object like wall or is falling on the ground. The assailant may apply force on the stick with his hands or may sit or stand on the stick. When two sticks are used, one each is kept on anterior and posterior part of neck and their ends are compressed with hands or rope. So that is nothing but Bansdola. Either you can use one or two sticks. So this was about the ligature strangulation, throttling and Bansdola. Moving ahead, now what is garroting? It is compression of neck by a rope thrown from behind. Mugging, it is compression of neck by elbow or in the bend of the elbow. Strangulation by knee or foot is compression of the neck by knee or foot. So this was about the types of strangulation. Now what is the meaning of local external postmortem appearance? In local external PM findings, it depends upon the method of strangulation. So what are the findings in ligature strangulation? There is a ligature mark present on or below the thyroid. The ligature mark is horizontal, complete and continuous, that is present all around the neck. However, the mark is more clear on the anterior side of the neck and may be rarely absent on the posterior side. But in hanging, the mark is above thyroid, oblique, symmetrical and incomplete. In hanging it is above thyroid, but in strangulation, ligature strangulation, it is below thyroid. In hanging it is incomplete, but in ligature strangulation it is complete. Usually there are multiple marks present at the multiple rounds of ligature, and as the multiple rounds of ligature are made round the neck and it is complete as usually no knot is tied. Because no knot is there, obviously it is going to be a complete complete round. However, at times multiple knots may be tied. Rarely the mark may be oblique. Example, if victim is sitting and assailant is standing, or victim is dragging with ligature around his neck. Victim is dragged with ligature around his neck. So rarely in which of the following cases the mark may be oblique? if the victim is sitting and assailant is standing, or the victim is dragged with ligature around his neck. So what is the appearance of ligature mark? What are the position? Mark is usually present on or below the thyroid. Surface of ligature may be as abrasion or contusion, but is usually as laceration and therefore shows frank bleeding. Due to excessive force applied, the pattern of ligature is not appreciable. Because of frank bleeding, that area is soft. What about color? Is initially yellowish brown but is later black. Margins show frank bleeding. Surrounding skin show multiple hemorrhages. Depth of mark is relatively more and therefore usually seen as a groove. Now, what are the findings in throttling, which is manual strangulation? On the neck, there are injuries due to fingertips and nails. Injuries due to thumb are seen better as compared to fingers. At times, sudden death due to neurogenic shock, even due to slight pressure on carotid sinus, may occur. Due to fingertips, there result oval to circular 1.5 to 2 cm in diameter contusions. These contusions are initially red and soft, but later become brown and hard. No contusion may be seen if a cloth is kept in between the hands and neck, and the compression with fingers is continued till beyond death, since after death there will be no extravasation of blood. So what they are trying to say is the compression with the fingers is continued till beyond death. So after death there will be no extravasation of blood. And first is if the cloth is kept between hand and neck. Due to nails, injury produced may be abrasion or laceration, as it depends upon the amount of force applied and length of nails. When the force applied is less or medium, the injury is multiple linear abrasions. When the force applied is moderate or more, the injuries are semilunar lacerations, being relatively close to each other. And when the force applied is severe, the individual lacerations overlap so that a bleeding line is seen. Maybe no injury, glows are worn. Coming to throttling with one hand, if one hand is used in a right-handed assailant, injuries due to thumb are present on the right side of the neck, and due to fingers are present on the left side of the neck of the victim. Injuries due to fingers are placed vertically one above the another. Throttling with both hands. When both hands are used to compress the neck, injuries depend upon the position of hands. Hands are placed opposite to each other, that is one each on anterior and posterior. So parts of neck. Injuries due to both the thumbs are present on the right side of the neck, and due to all fingers are on the left side. Both the hands are placed on anterior part of the neck. Then injuries due to thumb or of the right hand and 4 fingers of left hand are produced on the right side, and vice versa. Both the hands are placed on the anterior side, one overlapping the other. There are multiple vague contusions on neck. And if victim is lying, both the thumbs produce injuries on the same side of neck and all the fingers on opposite or lateral side. So these are the conditions in which position of victim also is responsible for the location of marks or injuries. But more than this, you have to remember regarding the types of strangulation introduction: ligature strangulation, throttling, Bansdola, garroting, mugging, and strangulation by knee or foot. So you can write these points to extend your answer. So moving to next question, what is the difference between hanging and strangulation? Very important question. So we'll first compare the general characteristics. In hanging, there is suspension of body. Strangulation, no suspension. Yes, we know why. Because hanging is caused due to internal force, or say endogenous force, and strangulation is caused due to external force. Second, compression of neck is by a ligature. Compression of neck is by either ligature, hands, sticks, elbow, knee, or foot. Third, force of compression is the weight of body, which is endogenous force, and in strangulation it is outside force applied, which is exogenous force. What about local external PM findings? Ligature mark is above the thyroid, is oblique, symmetrical, and incomplete. And in strangulation, mark is on or below the thyroid, is horizontal, complete, and continuous. In absence of ligature mark, there are other injuries on neck depending upon the strangulation. Fifth, not usually present. Fifth, usually absent. Sixth, usually no mark at the side of knot. In fixed knot, mark is inverted V-shaped, but mark is horizontal, complete, and continuous in case of strangulation. In running knot, mark is transverse. So these points are very important with respect to fixed knot and running knot. If knot is fixed, then mark is inverted V shape. Fine. And if there is running knot, then mark is transverse. You can imagine. Seventh, mark is usually single, usually multiple marks. Surface of mark abraded or contused, usually lacerated. There is usual abrasion or contusion in hanging, while there is laceration in strangulation. Surface may show pattern of ligature used, and pattern is not seen here. Surface is hard, soft due to frank bleeding. Mark yellowish brown in color, it is black in color in strangulation. Margins of mark show petechial hemorrhages, frank bleeding is present. Surrounding skin shows few petechial hemorrhages and multiple hemorrhages are present in strangulation. Depth of mark is less, depth of mark is more, like a groove in strangulation, obviously, because external force is applied in strangulation. Now, what are the local internal PM findings in hanging? Under the mark area is seen as dry, white, glistening pad of fat. But in your strangulation, area is hemorrhagic. In hanging, muscles may be lacerated, and here also those are lacerated. Usually no laceration of blood vessels and their walls lacerated in judicial hanging, but in strangulation all of them are lacerated. Maybe fracture of trachea, thyroid and larynx. So in strangulation those are usually fractured. Cervical vertebrae fractured usually at C2, C3, C3, C4 or C1, C2 in judicial hanging, but fracture of cervical vertebrae is uncommon in strangulation. Fracture of hyoid bone is uncommon in hanging, but fracture of hyoid bone of adduction type, which is inward compression fracture, very common in throttling. And in 21, injury to spinal cord, pons and medulla common in judicial hanging, and no injury to spinal cord, pons and medulla. Now, what are the signs of struggle and violence? In hanging, signs of struggle and violence are absent, but in strangulation, due to struggle, abrasions and contusions present on the body. Clothes may be torn. 23rd, no question of sexual assault on female victim, as this is usually suicidal and it is uncommon in females. 23, maybe sexual assault on female victim. 24th, since hanging is usually suicidal, no question of hiding the cause of death. But since strangulation is usually homicidal, there is attempt at hiding the crime. Dead body may be hanged, thrown in water, jungle, or acid it may be burnt. Now, what are the general external PM findings? Features of asphyxia are mild. Those are greatly marked in strangulation. Head is tilted to side opposite to knot, and no such tilting is there. Remember, this is very important point. There is no such tilting in strangulation, but head is tilted to side opposite to the knot. Neck is stretched. There is no stretching of neck. Face usually pale. Face is deeply congested and deeply cynosed in strangulation. Mild cyanosis on nose, lips, tongue, ears and nails. Severe cyanosis is there in strangulation. Few petechial hemorrhages in eyes and on face. Multiple petechial hemorrhages. Tongue usually is inside. Tongue is protruded, beaten and black in strangulation. Bloody froth at nose and mouth is sometimes present, but it is usually present in strangulation. Sometimes, usually there is dribbling of saliva from angle of mouth, and it is absent in strangulation. Dribbling of saliva is vertically downwards from angle of mouth in a tilted neck. But in strangulation, even if rarely present, dribbling of saliva is never vertically downwards. No bleeding from nose, mouth and ears. Oronasal and oral bleeding usually present. Due to pressure on cervical sympathetic, one eye may be open, no such finding. Petechial hemorrhages present on distal parts of the lower limbs. No such petechia is found in strangulation. PM levity is present on all around the distal half of upper and lower limbs. Site of PM levity depends upon the posture of dead body. Now, what are the general internal PM findings? Rarely there are emphysematous bullae on lungs in hanging, but those are absent in strangulation. Blood is of normal color in hanging, but it is dark blood in strangulation. Brain is pale, brain is congested. Now, what are the medico-legal aspects? Hanging is relatively less violent than than strangulation, but strangulation is most violent. Hanging is suicidal, strangulation is homicidal. Hanging is done by male, strangulation is done by may be done by male or female. Judicial hanging is a method of capital punishment in India, and garroting was a method of capital punishment in Spain. What was garroting? Try to remember what was garroting. Compression of neck by a rope thrown from behind. That is called as garroting. So, moving ahead, hanging may be post-mortem, but no question of post-mortem strangulation. So, this was all about the differences between strangulation and hanging. Just remember, you have to categorize it in medico-legal aspect, general internal PM findings, external PM findings, and your general characteristics. So, in total, we have got 46 differences between hanging and strangulation. Moving to last question of this video, ligature mark in hanging. Fine, write a note on ligature mark in hanging. We already read this. You have to write about ligature mark. So we'll quickly read this. Local external PM appearance. Externally on the local area, that is neck, there is a ligature mark which is present above thyroid. Remember, it is present above thyroid, is oblique, symmetrical and incomplete, and is deeper on side opposite the knot. Sometimes, along with the body, the ligature is also brought in this case. Note, size and length of the ligature so as to confirm that it was used as ligature and that it can cause suspension of that body. Then any blood stains, skin or hair on the ligature, and if the ligature is still tied around the neck, photograph the ligature and then cut it, preserving the knot. So what you have to do in local external PM appearance, you have to note down the size and length. If any blood stain is there, you have to collect it, and if it is still tied around the neck, photograph the ligature and then cut it, preserving the knot. Now what are the types of ligature mark? So in total, two types of ligature mark: typical ligature mark or typical ligature mark. Typical ligature mark. A typical ligature mark means a ligature mark present in the upper half of the neck above the thyroid, being oblique, bilaterally symmetrical, extending to the angles of the mandible, then to mastoid and finally to the occipital protuberance. Such a symmetrical oblique ligature mark is only possible in complete hanging, when the knot is tied on the posterior part of the neck. In this case, there is max possibility of occlusion of arteries. So typical ligature mark is rare. You need a knot which is exactly at the back or say posterior part of the neck, and the ligature mark is complete, bilaterally symmetrical and above the thyroid. Remember, above thyroid. What is atypical? Any variation from typical is known as atypical. Appearance of ligature mark. Position. The ligature mark is above thyroid in 80% cases of hanging. Surface. The surface of mark is abraded, contused or as confused abrasion. Sometimes the mark is patterned, that is, the pattern of ligature is reproduced on the skin. What about color? The mark is initially yellowish brown, later it becomes dark brown, parchment-like and hard. So we read about position, surface and color. Color becomes yellowish and dark brown. What about surface? Confused abrasion, and position 80% it is above thyroid. What about margins? Show petechial hemorrhages. Surrounding skin show few petechial hemorrhages, and depth of mark is variable and depends upon the type of ligature. If the ligature is soft and broad like sari or dupatta, the mark is faint and shallow. While if the ligature is thin and hard like iron wire or say nylon wire, then mark is clear and deep. Any fiber transferred from the ligature is picked up by transparent tape for subsequent examination. In all cases, position, color, length, width, surface margin, surrounding skin and internal findings of neck should be described in PM report. Now what are the variations in ligature mark? Mark may be below thyroid if hanging is partial. Mark may be circular when multiple rounds of ligature made round the neck and no knot is tied. Mark may be absent. It is usually absent on posterior part of neck because of thick neck musculature and hair intervening. Mark is usually absent at the site of knot. Mark may be present or mark may be absent due to intervening shirt collar. It may be absent on anterior aspect of neck because of long beard. It may be absent, patchy or faint if soft material is used as ligature. However, a faint ligature mark is still visible under the UV light. So these are the appearances of ligature marks, then variations in ligature mark and types, typical or typical. And do not forget to write about local external PM appearance. So factors influencing the ligature mark: type of suspension and type of ligature. What is type of suspension? The ligature mark is present in upper half of the neck and is usually oblique, symmetrical and usually incomplete in complete suspension, while it is below the thyroid and usually transverse in partial suspension. Type of ligature: mark is better and deeper with thin and hard ligature like iron wire and nylon rope, while it is faint and superficial with soft ligature like cloth. Mark is better if knot is tight. Then types of knot: fixed knot and running knot. In fixed knot, ligature is tied round the neck in form of the fixed knot. In most hangings, knot is fixed. On suspension, the knot gets pulled up and therefore either there is no mark seen at the site of knot or if present, it is inverted V-shaped. Now, running knot, or that is also called a slipping knot. At one end of the ligature, a loop is made and through this, the other end of the ligature is taken out. On suspension, the knot remains but ligature around the neck tightens. Therefore, the mark is horizontal. Site of knot is: usually the mark is absent at the site of knot if the knot is tied on lateral aspects of neck. Multiple rounds of ligature: multiple marks are seen if multiple rounds of ligature are made round the neck. The mark is circular if no knot is tied. At times, there may be double mark present due to slippage of ligature upwards during suspension. Now, weight of body: more the weight, better the mark. Time of suspension, more the time of suspension, better is the mark. And false ligature mark is, what is the concept of false ligature mark? That is also called as pseudo strangulation. Due to excessive fat on the neck or ornaments around the neck or tight neck wear, sometimes a false mark resembling a ligature mark may be seen in a dead body due to excessive fat on the neck and heavy ornaments. So this was about this video, and then remaining questions will deal with we'll be dealing with the remaining questions in the next video. Until then, keep learning, keep growing. Bye.